Welcome back, everyone, to another deep dive.
Yeah.
This time we're going to do one specifically for our medical audience.
Ooh, exciting.
Yeah. So students, residents, all you guys out there.
All right.
If you're listening, we're going to be talking about Castleman's disease.
Yeah. Have you ever seen this?
You know, I have actually.
Interesting.
Yeah. I've seen it a couple of times on imaging.
And it's
one of those things, you don't see every day, but when you do, it's sort of
it's such a classic presentation.
Yeah.
So cool.
You're like, oh, yeah, I remember this from.
Yeah,
Oh.
totally. Like
Yeah.
med school or something.
Yeah.
Yeah.
So we're going to talk about it today, and we're going to focus mainly on the imaging findings of Castleman's disease.
Right, because that can be the key to diagnosis for a lot of these patients.
Exactly. Yeah. And it's a rare disorder to begin with.
Mm-hmm.
It's a lymphoproliferative disorder.
Yeah. It's also got these really cool names.
Oh, yeah.
Angiofollicular lymphoid hyperplasia or benign giant lymph node hyperplasia.
That's one of those things where if you're like reading a report, you're like, what is this?
I know, right?
And then you look it up, you're like, oh, okay. I kind of remember that.
Yeah.
Yeah.
Totally.
But so this deep dive is all about the imaging.
Right, let's get into it.
So there are two main histological types of Castleman's disease. And I think it's really important to distinguish these when we're looking at the imaging.
Yeah, absolutely. And the first one is called hyaline vascular Castleman's disease.
Okay.
And this one is by far the most common,
Yeah.
like 90% of cases.
Wow.
And it's usually seen in younger patients.
Interesting.
Yeah.
So when you said it's the most common one, what's the split then between the two different types?
Yeah, it's about 90% hyaline vascular and only 10% plasma cell.
Okay.
It's a big difference.
Wow. So 9 out of 10 times you see Castleman's, it's going to be the hyaline vascular.
Yep.
Interesting. Okay.
And what's fascinating here is how this type usually presents on imaging.
Okay.
It's usually a single avidly enhancing lesion that you'll see on CT or MRI.
Oh, wow.
Yeah, and it really just lights up.
Okay.
And most patients are actually asymptomatic.
Really?
Yeah, but in some cases, this single lesion can cause problems like airway or vascular compression, which is why imaging is so crucial.
So you said avid contrast enhancement.
Mm.
What exactly does that look like to a radiologist, when you're looking at these scans?
So imagine you're looking at a CT scan and you see this brightly lit up area that's the lesion just soaking up the contrast agent.
Okay.
Yeah. And it's signaling that there's a really rich network of blood vessels there.
I see.
So it really pops out at you on the scan.
Wow. Okay, so it's not subtle.
Not usually.
Okay.
No.
All right, so even though it's benign, could you give us an example of a clinical situation where this might cause a problem for a patient?
Sure. So let's say a patient comes in with shortness of breath and you do a CT scan and you see this large hyaline vascular lesion right next to the trachea.
Oh, I see.
So in that case, it's causing tracheal compression, and that can be life-threatening.
Wow. Yeah, okay.
So recognizing that on imaging can really make a difference.
Okay, so that's the hyaline vascular type.
Right.
Now let's talk about the other one, the plasma cell type.
All right, so this one's a bit less common, like we talked about.
Right.
And it's often seen in older patients.
Okay.
And here's where it gets really interesting.
Okay.
Unlike the hyaline vascular type plasma cell, Castleman's disease isn't always a single mass.
Interesting.
Yeah, it can present as multiple lesions, and it doesn't show the same intense enhancement.
Oh, so it kind of flies under the radar a bit.
Yeah, a little bit more subtle.
Okay, so why is that? Why is there this difference in the way they look on imaging?
So it has to do with the underlying pathology.
Okay.
The hyaline vascular type, remember, is marked by all those blood vessels.
Right.
But in the plasma cell type, you don't see that same degree of vascular proliferation. So there's just less contrast enhancement.
So clinically, I remember learning that the plasma cell type is more often associated with systemic symptoms.
Right. You're thinking about things like fever, fatigue, weight loss.
Exactly.
And that's important because it can point us towards other potential conditions like HIV or POEM syndrome.
Oh, wow. Okay.
Yeah. So those are things we need to consider in the differential diagnosis.
So for our listeners who are still maybe early in their training in radiology, what would you say is the most important thing to remember when it comes to imaging Castleman's disease?
Well, I think the key takeaway is that context is everything. You don't just want to look at the images in isolation.
Right.
You need to consider the patient's age, their symptoms, their medical history.
Yeah, put it all together.
Exactly. It's like solving a puzzle.
Yeah.
And sometimes the findings can be subtle. So recognizing those subtleties along with the clinical context can make a huge difference in making the right diagnosis.
Okay, I think that's a really good point. It's so easy to get tunnel vision when you're looking at images,
Yeah,
but you got to step back and look at the whole picture.
absolutely.
Yeah.
And that's how you become a good radiologist.
All right, so this has been really helpful.
I'm glad.
I think we covered a lot of ground today, and I hope our listeners learned something new about the imaging findings of Castleman's disease.
Me too.
And for anyone out there who's interested in learning more about this fascinating condition, there are tons of resources available online and in medical textbooks.
Right.
So keep those curious minds engaged.
Yeah.
And we'll catch you on our next deep dive.
See you later.
Bye. Bye. Okay. Great job.
Awesome.
Yeah.